Good morning everyone, I'm Rena Venice Laxamana and I will perform a complete bed bath today. First is to review chart for any limitation in physical activity para ma-prevent po natin yung discomfort and injury. Next, gather equipments po para ma-save po natin yung time natin. Perform hand hygiene and put gloves to avoid the spread of microorganisms. Next is to identify the patient para malaman po natin na siya yung right patient sa right intervention and explain the procedure po para alam po niya kung anong gagawin natin. Then, provide privacy po as always para hindi po ma-expose yung katawan ng patient. Then, if meron pong sequential na compression devices, tanggalin po natin sila. Next is to offer a bedpan or urinal po para hindi po ma-interrupt yung procedure. And then remove gloves na po para maiwasan natin yung spread ng microorganism and perform hand hygiene. And then adjust the bed po para hindi po tayo mahirapan gumalaw. And next po is mag-gloves na po tayo, tas i-lower po natin yung side rails para sa gloves po para maiwasan natin yung spread ng microorganism. Tas kaya binaba po natin yung side rail para hindi po tayo mahirapan na gumalaw. And then, fill po natin yung basin ng 110 to 115 Fahrenheit. Warm water lang po para maging comfortable po yung patient. Loosen top covers and remove all except the top sheet po. Place bath blanket over patient po and then remove the top sheet po habang hinahawakan ng patient yung bath blanket para ma-maintain po natin yung warm na kailangan ng patient. And if naka-gown po siya, tanggalin po natin yung gown. So, sa patient ko naman po is wala siyang gown ngayon, kaya diretso na po tayo. And then, lay a towel across patient chest and on the top of the bath blanket po. Para ma-prevent po natin yung panglalamig ng patient. Then, next po is wipe na po natin yung eye ng patient and face. Dapat po wala po tong cleanser. Then next po is to bath patient face, neck, and ears. And if gusto niya pong mag-apply tayo ng moisturizer, mag-a-apply po tayo para ma-maintain po yung softness ng skin. And then next po is to expose the patient's forearm and place a towel po lengthwise sa baba po ng arm niya. Yung towel po, hinihelp po niya na hindi po mabasa yung bed ng patient. And then, para malinis po natin yung kamay niya na maayos. And then, maglagay po tayo ng towel sa side ng patient para kapag po binabad natin yung kamay niya or palm niya, is agad po natin mapatuyo po yung kamay niya para hindi po siya lamigin. Then, repeat actions 15 and 16 para po sa kabilang arm na mas malapit sa atin. And then, spread a towel across patient chest po. Ibaba po natin yung bath blanket hanggang sa pusod or umbilical area niya. And then, hugasan na po natin siya and patuyuin agad para hindi po lamigin yung patient. And if possible po, linisin na rin po natin yung umbilical area niya. And then after that po, return na po natin yung bath blanket sa original position. Binalik po natin siya para maiwasan po natin yung pagka-feeling na uncomfortable ng patient para makip pa rin po yung privacy niya. Next po is to place towel under foreleg po. Using firm strokes po and hugasan na po natin siya and then patuyuin. Ang ginamit ko po dito is na pagda-dry and pagwawash is from ankle to knee and knee to groin. Kaya po yun yung ginamit kong stroke is para yung firm strokes promotes venous return po. And then next po is wash and rinse if necessary po. Tapos patuyuin po natin yung foot niya between toes po and mag-apply po tayo ng lotion para hindi po siya maging dry. Then, next po is to repeat actions 21 and 22 sa kabilang paa po na mas malapit sa inyo. Lagi po nating i-make sure that patient is covered with bath blanket and change water and washcloth at this point po kasi ililikod na natin yung patient and we will bath it sa likod naman po niya. And then next po is inassist ko po yung patient into side lying position and nag-gloves na po ako and naglagay po ako ng extra towel sa baba para hindi po mabasa yung bed ng patient habang hinuhugasan or wina-wipe ko po yung likod niya and dinadry. And tuloy-tuloy lang po yung paghugas natin sa likod niya and buttocks. And next po is to raise the side rail na po and palitan po natin yung water and magpalit na po tayo ng gloves and towel. And then linisin na po natin yung perineal area niya. And if hindi naman po magkakaroon ng problema, we can offer patient a back rub po if gusto niya po. Para ma-improve po yung circulation ng tissues niya and ma-relax po yung patient natin. And dito nga po, wala naman pong gown yung patient natin, kaya tuloy-tuloy na po yung procedure. Next po is ginawa ko is change bed linen and dinispose na po yung soiled linens para po maiwasan natin yung infection transmission and spread po ng microorganism. And then after that po is raise the side rails as always po para hindi po mahulog yung patient and make sure that she's comfortable na po. And then document all what you did po. So, the next procedure po is shampooing the patient. Una ko pong ginawa is to perform hand hygiene and wear gloves po para maiwasan natin yung spread ng microorganisms. And then, lower the head of the bed and remove the pillow po and maglagay po tayo ng protective pad under patient's head po para hindi po mabasa yung bed ng patient. And then, place drain container underneath the drain of the shampoo board po para doon po malagay yung tubig na binubuhos natin sa buhok ng patient. And then, ask him or her to hold folded washcloth po sa forehead niya or sa eyes niya din po para hindi po malagyan yung mata ng patient and hindi po siya ma-irritate. And then, fill the pitcher with warm water, 43 degrees Celsius to 46 degrees Celsius po. And then, mag-apply na po na tayo ng konting amount na shampoo and massage. And then, hugasan na po natin yung buhok ng patient. And if gusto naman po niya mag-conditioner, we can put conditioner po. Pero ito po, yung patient ko po is ayaw niya po mag-put ng conditioner. And then, sinuklay ko na po siya. And then, tinanggal ko na po yung basin. And then, after that, pinatuyo ko na po siya using towel. And then, I asked her if she wants to use blow dry para po agad matuyo yung buhok niya. And she refuses po. Kaya, I continue the procedure na lang po. And then, tinanggal ko na po yung protective pad. And then, after that po, binalik ko na po yung pillow para maging comfortable na po yung patient. And tinanggal ko na rin po yung washcloth sa mata niya or forehead niya. And then, after that po, remove na po yung gloves and then perform hand hygiene to prevent the spread of microorganisms. And then, next procedure po natin is oral hygiene and yung patient ko po is conscious. So, the first thing to do po is perform hand hygiene and put gloves to prevent the spread of microorganisms. And then, maglagay po tayo ng towel sa baba ng chin ng patient para hindi po mabigyan ng tubig yung damit ng patient or gown ng patient. And then, let's put towel po sa baba ng neck ng patient to support her para hindi po siya mabulunan. And then, apply toothpaste na po sa toothbrush and then brush the patient's teeth po. And then, ipag-rinse po natin siya ng water and then padura po natin siya. And then, next po is to offer her a mouthwash if gusto po niya. And then, perform it na po. And then, floss din po, 6 inches yung haba. And then, floss the patient and ipagmumog po natin siya and then remove the water inside the patient's mouth po. Then, I offered her a lip balm also po para hindi po mag-dry yung lips niya. And then, after all the procedures po, let's wipe the patient's mouth po para ma-provide po natin na comfortable po siya and malinis po yung mouth niya or surroundings ng mouth niya. And then after that po, remove gloves and perform hand hygiene. First po is to perform hand hygiene and wear gloves para po maiwasan natin yung spread ng microorganisms. Then, make sure po na nakasara po yung room or door or curtain if meron po to provide patient's privacy. And then, ayusin po natin yung bed into comfortable position. And then, assist the patient into comfortable position para hindi po mahirapan yung patient natin. And habang ginagawa po natin yung procedures, hindi po siya nasasaktan. And then, warm lubricant or lotion in the palm of your hand po and start the massage po or procedure. First po is effleurage or stroking. Nakakatulong po ito to relieve and sedative effect. And then, next po is friction. These movement are in circular nature po and nakakatulong po to reduce swelling after nerve inflammation. And then, next po is tapotement or yung tinata po or beating or kinakla po natin, ini-increase po niya yung blood supply and strengthens the muscle. And then last po is kneading. Dito po ginagawa natin is grafting and lifting the tissue po. And after performing all the massages po, ibalik na po natin yung patient sa comfortable position. And then after that po is tanungin po natin yung patient if comfortable na po ba siya or wala na siyang kailangan. And then lastly po is to perform hand hygiene to prevent the spread of microorganisms. Good morning everyone, I'm Rena, Venice, Laxamana. Today I'll perform a hot application. This will help to increase blood flow. Verify the patient as his name, birthday, and age, and check the ID band. We do this to perform the right intervention. Verify the order for what type of moist heat application, location, duration, and desired temperature. Review client's chart for medical history and contraindication that may prohibit the use of hot or warm therapy. Assess the client's skin around the area to be treated for us to know where to apply the warm compress. Inspect wound, if any, for size, color, tenderness, or odor, for us to know how severe it is. Next is to explain to the patient or assess the patient and the family to understand the procedure. Next is to assess the client's vital signs and mobility for us to know if it's stable or not. Identify expected outcomes for us to be able to be aware what will the outcome will be. Gather all equipments to save time. Next is to explain the procedure clearly and ask for the patient's approval if it is okay for him to do the procedure. Describe the sensation patient would feel so that hindi siya mabibigla sa mararamdaman niya. Next is to perform hand hygiene and wear gloves to prevent the spread of microorganisms. Next is to place a towel under the area you will treat para maging komportable yung patient and hindi po mabasa yung bed niya. Next is to apply heat compress in the affected area. The indication for this, he has muscle spasm and soreness. The benefit for this, it helps promote circulation and encourage healing. It also decreases pain and discomfort. After the prescribed time for the treatment, up to 30 minutes for warm compress, remove the warm compress. Stop immediately if untoward incident or problem occur. Inspect the body part of the wound condition for us to know kung paano po siya ka-effective yung therapy and kung sensitive po ba siya kapag hinahawakan siya. Next is to ask the client to describe the level. In this case po, tinanong ko po siya up to 10 kung paano po siya nag-improve and he said 7. So, there is still an improvement. Then, check again for the vital signs and compare it to the baseline in the first vital signs you take. The contraindication for hot applications are not applicable for person who have fever, malignant tumors, dermatitis, impaired circulation, impaired skin sensation. Then, after checking the vital signs, let's identify any unexpected outcome po. Assess the patient before and after the application. So, based on my assessment po, may improvement naman daw po yung pag-a-apply ng hot compress, which is medyo nabawasan po yung sakit ng paa niya. And after that po, document and report all the information and the procedure we perform. A warm compress can help us to increase blood flow to sore areas of the body and can help to reduce pain and speed up healing process. Indications may be muscle spasms and soreness, ear infection, boils, menstrual cramps, or edema. Next is applying a cold compress. It's used to cool an injured area, reduce pain, swelling, and inflammation, which can help slow bleeding and minimize bruising. First is to verify the patient para hindi po tayo magkamali sa ibibigay nating intervention. Next is to verify doctor's order. What type of moist cold application, location, and duration. Next is to review client's chart. Assess client's skin around area to be treated. Inspect wound if any, size, color, odor, or tenderness. Assess the client and family awareness sa procedure po para alam nila kung anong mafe-feel and gagawin natin sa kanila. Next, assess the client's vital signs and mobility. I-check po muna natin yung baseline na vital signs, then after the procedure, uulitin po natin siya. Then, identify expected outcomes para alam po natin kung ano yung tinitignan natin or dapat natin ma-achieve. After that, let's assemble and prepare equipments needed po. Then, explain the procedure clearly and ask the client if okay lang po bang gawin natin yung procedure sa kanya. Then, after that, describe po natin kung anong mafe-feel niya kapag nilagay natin siya para hindi siya mabigla sa mafe-feel niya po pag in-apply na natin yung compress. Then, provide privacy at all times. Then, position the patient and expose the area only, yung lalagyan po lang natin ng cold application. Then, perform hand hygiene and apply clean gloves to prevent the spread of microorganisms. Then, place a towel or waterproof pad under the area we will treat para hindi po mabasa yung patient natin. Put some ice in the water so that it's a cold compress. And then, ibabad po natin yung towel natin na cold compress. And then, i-apply na po natin sa affected area ng patient. Ang indication po natin dito, yung patient is may toothache or dental pain. Tutulungan po nito na mabawasan yung pamamaga or it can also help numb dahil nga po malamig yung i-apply natin for temporary pain relief. Remove, remoisten, and reapply for 20 minutes para ma-maintain po natin yung cold temperature as needed. The contraindications for this are in cases of impaired circulation, cold hypersensitivity, open wounds, and certain other conditions. Check skin condition if may improvement po ba or lumala siya para alam po natin kung anong gagawin nating next procedure. And then, take note po, stop application immediately pag hindi na po comfortable yung patient. Application of cold compress is only for 20 minutes po. Then, after that, check the vital signs again if may improvement po ba or stable pa rin po ba siya or tumaas siya. The indications of cold compress or cold application after direct trauma, muscle spasms, dental pain, after muscle sprains, treatment of a chronic pain. After all the procedure, assess it if it is effective or not effective, and tingnan po natin if may improvement po ba before and after application of cold compress. Then, help the client to a comfortable position para hindi po siya nahihirapan. Then, ask the client to describe the level of comfort and burning sensation. Then, identify an unexpected outcome. Then, finally, remove your gloves and perform hand hygiene and document all the report. So, good morning everyone. I'm Rena, Venice, Laxamana. Today we will transfer a patient from chair to bed and bed to chair. First is to review the medical record and using nursing care plan para malaman po natin na siya yung right patient and this is the correct procedure. Next is to perform hand hygiene and wear gloves to prevent the spread of microorganisms. Next is to identify the patient as his name, age, birthday, and check his ID band para malaman po natin if siya yung right patient to the right procedure. And then explain the procedure para alam po niya and mabawasan yung anxiety niya. And then suot po natin yung gown niya to provide privacy and don't forget to give him sleepers po para hindi siya lamigin. Next is lower po natin yung side rails para malipat na po natin yung patient. And make sure the chair is locked. And then ilagay po natin yung wastegate sa waist niya. And then ilock po natin siya para mas easy po natin siyang matransfer sa bed. And then stand in front of the patient and hayaan po natin siyang hawakan yung shoulder natin para malesen yung iaangat natin sa kanya or yung weight. And then remove the wastegate para maging komportable na po yung patient natin. And then assist the patient into side-lying position and make sure that komportable po siya. And itaas natin yung paa niya in a count of 3. Then adjust him to the comfortable position, and let's provide the privacy by covering his or her with a linen or a clean linen. And then, let's ask the patient if komportable na po ba siya sa position niya, or may masakit po ba sa kanya, or may kailangan pa siya. And then, next is to remove gloves and perform hand hygiene. Raise side rails. Next is transferring patient bed to chair correctly. Review the medical record and nursing care plan para malaman po natin na siya yung right patient. And perform hand hygiene and put on gloves para maiwasan po natin yung spread ng microorganisms. Next is to identify the patient and explain the procedure. Identifying the patient para malaman po natin na siya yung correct patient and magawa natin yung correct procedure. Kapag in-explain po natin para mabawasan po yung anxiety niya and maging prepare po siya. Place the bed in the lowest position and raise the head of the bed to a sitting position. Para hindi po tayo masyadong mahirapan kapag inaangat natin yung patient. Pero dito po sa case namin is wala kaming bed na matataas. So, ibang procedure siya. Then, make sure the bed is locked. Then, assist the patient in the right position para maupo po natin siya ng maayos. Encourage the patient to make use of stand assist aid. Move the side of the bed into the side lying position para mabawasan po yung bigat and hindi po tayo masyadong mahirapan. And then lower the side rail para maupo po natin siya. Assist the patient to sit up and then hayaan po nating nakahang yung paa niya. And then suot po natin yung gown niya and then footwear para hindi po siya masyadong lamigin and hindi po ma-expose yung paa niya sa cold. And then, wrap the gait belt sa patient po to help support na pag iaangat na po natin siya para hindi po tayo masyadong mahirapan and hindi po malos yung balance niya. Stand facing the patient and spread feet about shoulder width apart and flex your hips and knees. Dahil dito po tayo kumukuha ng force. And then, ask the patient to slide his buttocks and para ma-help po tayo na konti na lang yung igagalaw or ibubuhat natin. Always encourage the patient to make use of the stand assist device. And then remove your gloves and perform hand hygiene.